Welcome back to another episode of Time Out with the Sports Doctor podcast, where life, sports, and medicine intersects. We are glad that you are part of this growing community where we strive to help you strengthen your mindset, help you grow your assets, and help you achieve whatever level of success that you want for your life. Go to our website at Dr.Derrick, thesportsdoctor.com, where you can find all the latest content, and you can also follow us on our social media channels. Now, let's get into this episode. Welcome back to another episode of Time Out with the Sports Doctor podcast, and I have a very special guest for you today, Dr. Wilsa Charles Malveaux, who is a close friend over probably 20 years now. I'd say 20 plus years of friendship, as well as she is the CEO and founder, as you can see, of WCM Sports Psych. She is also the Sports Psychiatry section editor for Psychiatric Times, and she's a great, mother, wife, entrepreneur, athlete, all in one. I'm very happy to have you on the show. Well overdue, but welcome, Wilson.
Thank you. Appreciate you.
Absolutely. So I have not done this many times. This is probably the third apology on my show. Once to my wife, once to my mom. But I will give a public apology because Dr. Wilsa should have been the first sports psychiatrist on the show. She was not. She is probably the second. I publicly apologize to you for that.
Yeah, and I'm not saying that is due because you didn't have an awesome guest, because you did. But I mean, dude, I've known you for years.
Yeah. Been through a lot. Been through a lot. Just a little backstory. So we met at Howard University College of Medicine, probably about 2 years apart. So we met probably about 2004, give or take.
Mhm.
She was Wilsa Charles at the time.
Wilsa Charles.
Now she's Dr. Wilsa Charles Malveaux. So shout out to Raymond Malveaux, who is part of that inner circle when we first entered into Howard for
Yeah.
me, my road dog, my study guy, my everything. So shout out Ray. I see you back there.
I'm sure he appreciates the mention.
Oh yeah, absolutely.
Yeah.
But two became one. So now she's Dr. Wilsa Charles Malveaux. They have a beautiful family together. And it's great to just, to see how life changes and how things merge together as we get older, which is crazy, that we are getting older for sure.
I know. I know. I have my old lady glasses around here that just recently started to have to use with the computer. That was a wake-up call, to say
Yeah,
the least.
yeah. Well, like we mentioned, long-term relationship, long-term friendship. So let's first talk about you. I remember being first really impressed by, okay, she was a four-sport athlete growing up all the way through high school. Even at Stanford, I believe. Did you play two sports at Stanford?
No, they were trying to get me to do soccer and cheerleading, they not being my track coaches, because they told me,
Right.
"Absolutely not. You will not be doing those things." But some of the other people that were on the team, had expressed interest. I wanted to do it, but because of injury and I was on scholarship, my coaches said no. So my focus was track the whole time there. But I was recruited for soccer, around the country, actually, at the same time that I was being recruited for track and field, and decided to go to Stanford on a track scholarship.
So one of the things I do remember is how close you were to qualifying for the Olympics. So just kind of tell us about that.
I'm gonna make this a short story, semi a long story. When I was in high school, I was 5/100ths of a second off of the qualifying time when I was a junior in high school. And so the plan for everybody, including my coach outside of school, was that I was gonna focus on my times were dropping fast, and I was supposed to focus on track and field and drop everything else and just make that time so I could be at the trials, and that was back in '96. But in '95, I was playing in the soccer championships for the PBAC. I did not quit playing soccer, and my ankle was broken. First time I'd ever had a serious injury in my career, and it was actually a malicious injury from the other team, and I couldn't walk again for about 3 months, and my coach just stopped talking to me, and, that's a whole other story about how that, unfolded and how I got back into training. But that's how close I was then. And then in 2000, my dad's country, so my parents from the Caribbean, my mom's from Jamaica and my dad's from Grenada. And my dad's country actually offered me a spot on their team. They wanted me to run the 4x4, which I hated, but it was important. And they said I could pick two of my other events to do if I would represent them. But very foolishly, I actually ended up turning that down because I got caught up in basically worrying about what other people thought and how well I would do, and lost sight of my goal, which was just to go and compete in the Olympics. So I turned that down and said, I'm going to train harder so I can be even faster and do better next time. But then that opportunity didn't come again because of injury and surgeries and life. So that's the short version.
I think just from that explanation, you already gave us enough topics to discuss for a whole episode because we talk so much about single sport specialization now, right? And when is it time to do that? Because right now, sometimes you'll see 9, 10, 11 year olds really only focusing on one sport. But I do feel that there is an age where single sport specialization should happen, especially
Mhm.
if you're starting to excel. So, is that something that you get asked about in your practice when you're dealing with athletes? And how do you typically talk to them about it?
I think what the athlete is passionate about, especially if you're talking about youth sports, is very important. It's not so much that I get asked about that a lot from the parents. What I've seen, one case in particular that's come to my mind as we talk about this, is an athlete that her parents wanted her to be like a world class gymnast. And for a time, that's what she wanted to do. And she was doing well, but then had some problems with the coach at the gym she was working at, and ended up switching to work with another team and another coach at another gym. But she just realized that her passion for that wasn't there as much. But she had other sports that she was passionate about. But because of the parental focus on this being the one, they really didn't want her, to switch, and even though she had already demonstrated not just the interest, but the skill and a talent for the other sport as well. So, in that particular case, the more that that patient felt empowered to try to do something different, the parents got less comfortable with her actually getting support with her mental health, even though she was actually depressed from what she was dealing with, basically forced to do the one sport. So it comes up in different ways. I've thought a lot about how that plays out for kids and just the different ways that your different muscles are moved, and the different injuries that can happen if you're constantly doing the same motion versus if you get some variety throughout the year. But also with kids that put so much time into one sport that they kind of lose themselves in it and feel like that becomes their identity. And that's, I think, the other side of the focus on one sport that people don't talk about enough. I've definitely seen that happen. And when they, thinking of a basketball player right now, end up not making it as far as they thought that they would or hoped to, then that becomes like a whole identity crisis that has to be dealt with. So I think there's a lot of different angles that we have to talk about single sport athlete and how long do you diversify that?
Yeah. And, sports psychiatry is definitely a growing field. It's something that I didn't hear anything about really 15, 20 years ago with dealing with athletes, but definitely starting to hear more about it, starting to see more psychiatrists like yourself who are really specializing in dealing with athletes. So they're not going to see the same person that's just dealing with other psychiatric illnesses. So, talk to us a little bit about what sports psychiatry is as a field and how you got into it.
So, sports psychiatry, first of all, psychiatry is a field of medicine. And so if you're a psychiatrist, you're a medical doctor. So you have a MD or a DO degree. A lot of people think that that just means the difference is that we're the ones who can prescribe, but it goes a lot deeper than that. We really understand the brain body connection and are able to kind of use our knowledge of medicine, not kind of, but use our knowledge of medicine to rule out other things that people might think is an actual primary psychiatric disorder, but it's actually a presentation of, it could be heart disease or it could be thyroid problems, things like that. With sports psychiatry in particular, the focus is, of course, working with athletes, but there's different ways even within the field to do that. Some people focus on it from a standpoint of the diagnosis and treatment of mental illness in athletes, which is part of what you and I do, but also the performance side of it, which has to do with not just the psychology portion, but also in terms of mental health, what are the other things that are getting in the way of them being able to perform at their best? So that might be an actual mental illness that needs to be managed, may or may not require medications. Would if it's something that's more serious, like bipolar disorder or even a psychotic illness. But then also things like ADHD and anxiety, and being able to find ways that manage those different disorders that come up without impairing their performance, and making sure that they are also not breaking any rules in terms of anti-doping regulations. So that's a big part of what I do, both the medical side and also the performance side in the work that I do with athletes.
And as you were saying that, I thought about the fact that as a psychiatrist, you've been on all the different rotations where a psychologist has a PhD trained in psychology. You've been on internal medicine, surgery, orthopedics, pediatrics. You've been on the wards, you've treated patients. So being able to rule out, like you said, medical conditions that can sometimes pose as psychiatric conditions is important too.
It definitely is. But I do want to say too that I have a deep respect for my colleagues in psychology that work in the field. They've been in this field longer than psychiatrists by far, first of all. And the ability to help athletes even greater when we are working in collaboration, that is also something that I've really enjoyed in my career. And the people that understand that too, like we're both bringing something that's so valuable. And my psychologist colleagues, they have some knowledge about some of these conditions because that helps them to know when do we need to reach out to a medical professional to bring that other side of the treatment. So yeah, I just want to say that I have the utmost respect for that and love working in collaboration because then we really get I like a holistic approach to working with athletes. So then we can get really a 360 approach to helping them.
Absolutely. And thank you for cleaning that up a little bit. Definitely was not trying to downplay the role of psychologists in the care of athletes or the care of people because you are a shortage. Even you combine both together, mental health in many different arenas is being ignored simply because of the shortage of psychiatric care that can be provided. So I
Yes.
know there's a long wait list to get
Yeah.
in to see a professional like yourself. So tell us a little bit about WCM Sports Psych, your practice and your model.
Thank you for asking. So, this business of mine has been really a passion of mine for a very long time. And I do clinical work working directly with individuals that need that support. But a larger part of what I'm doing, not more important, but just bigger part, is really finding the ways to bring that information, that education, the knowledge, the exposure, and decreasing the stigma to a wider audience than I ever could sitting here talking to people one on one. So, what I do to do that is there's a lot of media work. Public speaking is another thing that is a part of that, going out and actually giving talks where it's not just to big audiences like corporate audiences or big national organizations and teams, which I do, but also to younger groups like the students to educate them on mental health, mental wellness, which we all have mental health and mental wellness, even if we don't have mental illness. And then I create educational tools as well to share and help spread that information. Because I know that because there's such a long wait and because it's so expensive sometimes to see a provider, there's a lot of people who never get the help otherwise. So I personally take it as my duty to spread the information that's necessary so that everyone has access.
And talk about the role of social media and how that is, of course, you're not everybody's provider on social media, but how
Yeah.
is that a tool to help, because athletes are scrolling, parents are scrolling. How do you utilize that as part of your armamentarium, so to speak?
It's such a big tool. It's such a big resource. And on one side, it's kind of dangerous because there's people on it that don't necessarily have the background and the information, but they're putting out content. And unfortunately, in this day and age, people don't necessarily understand the difference in like the credentials and the training that one person, a professional, might have versus someone else. So it's important to put that information out there for people to see and let them know that there's different types of providers, different areas, and they should be working, within their scope. And if your provider doesn't have a title that requires a license or any certification, or there's no regulations or training, that's something that you might want to take pause with if you're going to work with them. But it's for those of us who are able to put out true and helpful educational information. It reaches so many more people. People don't have time to sit and read books all the time, or nor they do have the finances to invest in that or the interest. So to be able to talk with people and let them really see you, hear you, connect with you, and get the information they need, you never know how many people it reaches.
And that's one thing I know a lot of people with this podcast, a lot of people are not going to sit down for 30 minutes, an hour, however long the episode and digest all of it. But being able to cut this up into little clips, 20, 30 seconds, people can still get a piece of information. And if they desire to, then go listen to it. So definitely, I think social media is important. And it's important to have professionals there because, like you mentioned, a lot of people that are on there giving advice are just talking about what they think or what they feel or believe and not really backing it up with science.
Absolutely. And people can be very popular doing it, but it's important not to confuse popularity with the actual content that is correct information. Yeah.
Yeah, absolutely. So you mentioned mental health and wellness versus mental illness. So we know that there's definitely a stigma around mental illness, and we all have mental health and maybe even a mental illness to some degree,
Hmm.
but many people ignore it or don't want to talk about it publicly because they don't want to be crazy, right? So
Yes.
let's talk about what that spectrum of mental health and wellness versus mental illness and where that line kind of grays sometimes.
I'm glad you asked that question. It's come up many times, and surprisingly, not just in just the general community, but even in situations where there's conversations with other people within the realm of mental health and wellness providers. Oftentimes, now as time has gone on, people have more understanding, appreciation, and less trepidation about the performance side of things. People aren't afraid to say that they have a performance coach or mental performance coach that they work with. But anytime you get into a title of something that sounds at all clinical, that's where you get the, oh, I'm not crazy, or I don't need that. The problem with that is that it's not a matter of being crazy or not crazy. It's just about taking care of your health. So just like you said, it's a spectrum, and someone might have anxiety. Does that mean that it's debilitating anxiety? Not necessarily, but if it is debilitating anxiety, do they need to be assessed to see, do they need some assistance with that, whether that's psychotherapy alone or psychotherapy plus medications together to get them better? The goal being for them to be able to live their best life and perform their best, both in their actual sport, but also just in life in general. So when we pathologize the idea of taking care of your mental health as opposed to taking care of your physical health, what it does is it gets in the way and it stigmatizes it so that people feel like, well, if I do this, it means that there's something wrong with me. As opposed to, if I do this, I'm being smart because I'm giving myself the edge in life and the best chance to do the best that I can do. So it's really important to reframe that. And that's work that I do regularly on social media and for years before that, so that more people can feel free to get the help they need and to change the culture of the organizations and the conversations in the community so people don't feel like they are somehow lesser than or weaker in some other ways pathologized if they're taking care of their mental health, just like they would their body.
Yeah, thank you for that explanation. And I apologize for your delayed appearance on the show. However, I think this is the perfect time because it's a new academic school year. You have college athletes reporting back to college. You have NFL on new teams. You might have been released, or you
Mhm.
might be, or about to be released, or in a new organization. So I think this is a perfect time to speak to athletes and to speak to parents and coaches to say be on the lookout for someone who might be struggling, for someone who might be withdrawn, someone who might be isolated. And it takes the whole team. The players are responsible, the trainers are responsible, physicians, parents, everyone has to have their eyes on the athlete. So when you notice something is not right, you need to speak up or have a private conversation with that person. So let's talk about just the health of athletes in this time of the year. You're under a lot of stress, trying to make the team, trying to make the roster. So let's talk about that a little bit.
Sure. A lot of places are starting to include mental health screening in their sports pre participation screening. So I think that that's a huge plus for athletes and their safety. I was actually just reading a study recently that was talking about the level of competitiveness for athletes in their sport. And whereas in this study, they found that the more competitive it was actually protective against things like suicidality. There are other studies that actually say the opposite. So we still need to find out that information, however, because what it tells us is partially how that athlete feels bonded to their performance in that sport. Is there some link for them between their performance in the sport and their sense of their own self worth? Because if that is damaged, then that's going to put them at risk for depression and other thoughts, like potentially the suicidal thoughts. But also, just acknowledging that participation in general and access to participation is really important because overall, the benefits of being an athlete and working and learning about team dynamics and getting that exercise as well. All of that actually benefits mental health on the whole a lot better than children who don't get the chance to participate overall. So making sure that children have access, if there's barriers to access to play sports, like what is that that's happening? I'm very passionate for many reasons about neurodiversity in children and how that affects their access to things, including sport, but also how we can make it more accessible to them to be able to play. So for parents to pay attention to those things and if their kids are getting opportunities and what are the barriers for that and speaking up about it so that things can be done about it in the community so that they have that chance as well. So those are some of the things I think about as the school year starts.
Sure. So for someone that's saying, I think my athlete or my child could benefit from having a conversation with a sports psychiatrist, what does that look like in the real world of how they go from identified someone who needs help to getting them to your office? How does that look?
Are you a young physician who's frustrated in figuring out how you're going to continue to fund yourself through this early phase of your career? Are you tired of speaking to lenders who do not understand your plight? We have a solution for you. Let me introduce you to Doc2Doc Lending.
Hey everyone, I'm Dr. Zwade Marshall, co-founder, CEO of Doc2Doc Lending. We are the exclusive lending partner for physicians and dentists in the United States. We underwrite our loans thoughtfully, knowing the physician journey and your career trajectory. We're a company that's been founded by doctors and built for doctors because we get it. Banks don't understand all the ways in which we struggle through educational debt, consumer debt, as we're trying to make ends meet during a very challenging time of our lives. Doc2Doc is underwritten with thoughtful process that's meant to give you credit for all the unique physician characteristics that you have, like being board certified, having a dual degree, undergoing and finishing a specialty or a fellowship as well, and just being employed as a physician. All of those things give you credit to get your interest rate lower with our platform.
So we are glad to partner with Doc2Doc Lending. So if you are stuck trying to figure out where you can get funding or where you can continue to support your family during this time of transition in your career, we offer you a solution. Doc2Doc Lending, physician owned, understands your plight, understands what it's like to be an early physician or a physician who wants to do something outside of medicine. Check out Doc2Doc Lending. This segment is a paid advertisement for Doc2Doc Lending Inc. Loans are made available by DR Bank, member FDIC, and are subject to credit approval and available in approved states only. Representative APRs for Doc2Doc range from 9.99% to 26.99%. Terms and conditions available at doc2doclending.com.
So the first part, the identification is key. And, everyone is not going to have access, though I recommend it as much as possible to taking a mental health first aid class. But that is a huge benefit, not just for yourself, but for everybody that you come into contact with. Why? Because the way that we talk about it to each other has a big influence on if that person's going to open up to you, if they feel comfortable letting anybody know about what's going on, what they fear consequences might be, and how they feel about themselves if it's brought up. So in those types of classes, you get access to the right language and the words that can be more stigmatizing to avoid. The other thing is that the people who have contact, you're in a place that has athletic trainers that are at the school or sports physiotherapists. They're often the first ones that have connection with the athlete. So, and spend a lot of time working with them. So for those individuals to be on the lookout for changes in behavior and for parents, if they're school age children that are still home with parents or even college age that communicate with their parents, it's a change in behavior that should really spark the question, like, is everything okay? It doesn't have to look like how something is typically portrayed on TV or in a movie. It's just the difference that should let you know to check in with this person. Just ask them, tell them you notice that something is different. Tell them what it is and ask them, is everything okay? And just open that door. From there, your primary care provider is a first line person to go to because if it is something that seems to be a medical issue, they can also start to identify it. And if it's something that seems to need a psychiatrist to be involved, they can make that referral. For college athletes, they are more and more having sports psychologists who are accessible to them. And again, that collaboration I talked about with the psychiatrist and the psychologist they can then make those referrals. Or if you have a psychiatrist with the team, there's collaboration right there on site. The wait, I'm not going to lie, for outside referrals, it can take time. But you do have organizations that you can look on their website, and you can even Google and find people who are trained and have extra training and certification with sports psychiatry to help you. I'm on the board for the American Board of Sports and Performance Psychiatry. And we are also building logs of people that are trusted and capable providers. So looking for things like that can help to kind of weed out what you need versus what you don't.
Yeah, thank you for laying that roadmap out because many people, even in orthopedics, they'll say, how do I get to you? Do I need to go see my primary care doctor first? Do I have to have a referral? So all those things matter. And,
Good.
one thing as a surgeon, one definite area that I really think about sports psychiatry is from athletes after surgery. All right. So
Mm.
you have an injury, you're already dealing with the injury, you're
Yeah.
dealing with isolation from the team, you're
Yes.
dealing with the pressures of, like you mentioned earlier, will you be able to get back to your peak performance? You might have some external pressure from coaches, now NIL, right? Am I
Hmm.
going to lose my deals? So it's a lot of things you're thinking about, even not even thinking about your recovery, the pain
Yes.
from recovery and the will I ever be able to get back? I need to walk again. I have to run again. I have to be able to cut and do all the things. So when all of this comes down on an athlete, I never forget when I'm telling an athlete, one of the things I hate the most is having to tell an athlete their diagnosis.
Hmm.
And even after the diagnosis, sometimes they just completely almost like they saw a ghost. And you can tell it's almost like an out of body experience. And at
Hmm.
the time they still have to comprehend, okay, I'm about to have surgery. What does that mean for my classwork? How am I going to drive around? So many different things. But unfortunately, most of the athletes go without psychiatric support. And
Yeah.
sometimes you're on the other side of the world, at a college or playing for a team, and they have to figure out, okay, I really have no friends. I really have no support. How do I get through this phase of life? So talk to that group of people, or how do we better support that athlete or that person going through the changes of injury, recovery, and still having to try to be their normal selves?
That's such a good question because it's such a common experience. I mean, I've experienced it multiple times, and I know firsthand how devastating that could be. I know what it's like hearing that news. I know it's like being reassured that everything's okay and then walking to the office with the orthopedic surgeon to tell you that no, it's broken, and having to deal with that and process all of what that means. And first thing I want those athletes to know that it's normal to feel anxious in that time and to have questions. It makes sense to think of that because the reality is, especially once you get into collegiate sports, is a business. And there are going to be business decisions that need to be made. I think that because of how sports has evolved, kids are having to learn earlier about what that looks like and their role in it, which, can be hard lessons, but still important for life. I think there should be automatic referrals to mental health support once there is a serious injury. I think that should be not even just for one session because the likelihood of someone being able to come to grips with or realize even how they're impacted is not likely to be the first time that they talk with someone. So if schools are able to integrate that to where that's a part of their protocol, where they at least have a certain number of meetings that they have to do after they realize their injury and also what their prognosis is going to be and their time course is expected to get back to competition, that's going to be very important to look at. And then from there, every school is not going to have a sports psychiatrist that's there on staff, but we're located all over the country. People are licensed many times in different states. So your coordinator for mental health services for the athletic departments that a lot of schools have right now, or the therapists that are there, they can always look for referrals to an outside person. And a lot of times the schools will pay for that, especially if it's an athlete that they're invested in getting better. Now, what I have also seen is that sometimes it's determined that person is not expected to return to sport for that season or at all. It can get dicey in terms of what's covered or not. So I think it's very important for the athletes to empower themselves to find out from the compliance office that coverage for them. What does that look like? What do they have provided for them? How long is this provided after they're done with their sport or with school? What protections do they have in place? Just to give them a framework to understand what's happening and to put some of their worries at ease. But absolutely, recovery and having that mental health support during recovery it's going to be very closely tied and be very important to getting them back to sport or back to being healthy as soon as possible.
Yeah. And just first, I think it's important for the athlete to realize that it's nothing wrong with you with whatever you're feeling in that moment.
Yeah.
Whether it's anger, whether it's fear, everything you're feeling is normal and you have to be able to process it. So now it
Yeah.
might be normal at day one, but if you're still feeling that 18 months after your injury,
That's
then that might be a little pathological, right? So
yes.
you have to be able to deal with those feelings early on so they
Mhm.
don't continue to grow. Because what we know, especially ACLs, one of the things I treat the most, one of
Mhm.
the lead factors to you getting back to your level of competition is the fear of re-injury. And if you
Yeah.
never deal with that fear of your re-injury, that's the one reason why many people walk away from the game after the injury, or many people never reach their pre-injury potential because of fear of getting hurt again. So
Yes.
if you don't, you can't just ignore it. It's not going away. You have to deal with it.
I love that you brought that up. Not to to belabor this part of the conversation, but I really do love that you brought that up because I think that part of why people almost get frustrated with themselves as to why they're feeling this way is because they don't understand that all those different possible emotions and two people could have the same experience and deal with it completely differently, but it's all a response to loss. Like this is a grief response.
Yeah.
And, a lot of times people think about grief as, someone died, but it's not always that. The grief, you can grieve any type of loss. And this is a loss of functionality. Even if it's temporary, it's still a loss of functionality. It can be a loss of sport, depending on the degree of injury. And for a lot of people, it can be a loss of identity. So that's a whole lot of different things to process at that time. And it's important to have people who are attuned to that to talk to and to help them through that. Another thing that I wanted to bring up too is that when athletes have some anxiety beforehand, or maybe they have some depression beforehand, there's been studies that have shown that that mild symptoms of that, even pre-injury, it doesn't delay their time to recover after their injuries. It's when there's a pathologic or a diagnosed primary mental health issue with anxiety depression that puts them at greater risk for having delayed recovery. So if they know, even if they haven't spoken with someone to get that diagnosis formally made before, but if they know that that's something that they've been strongly struggling with, that's another indication for them to advocate for themselves and seek that help. Because if they do want to get back to play or increase their chances of getting back to play or just getting back to health, that's going to be a major part of their recovery time.
And thank you for bringing that up. I'm, taking mental notes myself of how I can better care for the athlete with referrals to a mental health provider, especially like you mentioned, if they have a history, I need to have my antennas up to get them help earlier and try to push so they can definitely get the care that they need. So you're
Absolutely.
helping me, and so hopefully you're helping somebody else. So I always
Good.
feel that I get consultations during my interviews anyway.
Well, you always have free consultations, so it's okay.
Got it. All right. So let's talk about Dr. Wilsa, right? So professional, doctor, entrepreneur, mom, wife. We know it's a lot. So how do you manage all these things and, care for yourself? I know you put out a challenge. We'll talk about that, but where do you
Mhm.
find time or how do you care for yourself while you're caring for other people's mental health and taking care of family?
I'm not gonna lie, that is extremely difficult, and it's also extremely important. A big motivation for me to do better at finding the time to do that is the fact that I do have these 3 kids, and I want, especially for my daughter, but for all of them, to understand that it's important to still take care of themselves no matter who else they're taking care of. And at no point in time do they just let go of themselves in terms of just what's important to them and their health because they need to be here. They need to be alive. They need to be living well. So I have to set that example. And there's a lot of sacrifice, as you know, just building a career in medicine in the first place. And we get so used to this idea of delayed gratification, which is an important one to understand, but sometimes we delay it too much. And it's taking work for myself even to recognize like, hey, like I know you're doing all this other stuff, but you're still Wilsa Charles Malveaux. And we gotta be her too. So that's a lesson that I've had to learn. And honestly, it's intentionality. I'm very big on moving with intention with things. That if you just try to let it happen, if you say to yourself, I'll get time, or when I find time, then I'm going to do this, or when things slow down, then I'm going to do that. If you're an ambitious person, that's not ever going to happen. Like I don't know how to be bored. I'm always busy and having ideas, but rest is a part of high performance. Sleep is a part of high performance, and I'm sure people who know me are laughing because I don't get enough. But it's so important, and you have to be intentional about it. Like, it has to be scheduled like it matters, and that's what I'm starting to do now because you feel different when you're taking care of yourself, and everything that you're juggling, the many responsibilities like what you mentioned, it becomes lighter when you're able to make sure that the foundation of that, which is you, is well supported. And you can't wait for other people to do that for you. You have to support yourself.
Yeah, thank you for being open and sharing. I mean, it's hard. Like you said, it's hard. And I know for me, I want to make sure everyone else is good. And then I'll neglect myself at times. But
Yes.
one thing about being on this podcast, it's almost like I was sitting here and many times I don't preach to people. I say, okay, this is what I feel. And I'm talking to myself. And at the same time, it's just like disciplining your children when you know, like, but you see that mirror and you're like, "Oh,
Yes.
yeah, that part." So,
Mhm.
I think it's really important and you have to be intentional about it. Like you said, life is not gonna happen by itself. The
Nope.
pace that we live at, having children, you think as they get older, but then they get more involved, right? So, I don't know
That's what I
when
heard. It's not giving me a lot of hope when you say stuff like that.
it changes, so the
Yeah, these
grind
kids are
just
small.
changes. Now you need 3 drivers instead of, just one person to get the kids to where they need to be. But at the
Yes,
same time, you can't serve them if you're not taking care of yourself. So,
absolutely.
thank you for putting that out there. And we all have to do better. So we're here together to support each other. That's what this community is about. But thank you for
Thank
putting
you.
that out there. All
Absolutely.
right.
Keep it real.
Keep it real. You got to. That's what we're here for. All
Yes.
right. So on Time Out with the Sports Doctor, this is your final timeout. So we talked about a lot on this. I know it's been very helpful for me from dealing with just mental health and wellness, what it means to athletes going back to school, new to sport. How can we better support them? But let's talk about everyone's not an athlete, right? Or I always tell people we're all different athletes, just playing different sports. But
Yeah.
we think about performance and we think about athletes, but we also have high achievers. So talk about their relationship and what when you're dealing with that CEO or the teacher or the coach, how is that similar to when you're dealing with athletes and they're from a psychiatric standpoint?
There's so much in common, and that's part of why I do work with high achievers, other high performers, because there's so much parallel. First of all, there's a lot of them who were former athletes, and they take that same mentality into the next chapter of what they're doing, and the chapter after that. So it continues because it's in you. When it's in you, it's in you. But even if someone has never been a high performer in sports, still those concepts of, yes, delayed gratification, but also knowing when to rest, understanding that rest and energy management is important for sustaining your performance. When I say energy management, I think about the book Powerful Engagement and the fact that you can spend 30 minutes doing something that makes you feel completely drained and you have no energy left after that, for example, versus 30 minutes of something that you feel like really invigorates you, incites you, pours back into your cup, and you feel empowered to like take on whatever's next. If you never plan to have those periods where you pour back into yourself, you're not going to be able to keep performing. So it doesn't have to be like recovery workouts for an athlete when you're talking about a high performer, it's recovery periods for your life. So what does that look like for you as an individual? Does that mean like time meditating? Does that mean time just going for a walk? Does that mean time listening to your favorite music or dancing or whatever it is that you like to do. Building time into your schedule for those things is key. But another lesson, there's so many, so I won't be able to talk about everything. But another thing I want to say is this separation, which I learned the very hard way through sports and then also actually through my medical career, but that separation of your identity from what you do. I think that is so, so important for anybody that's a high achiever, a high performer. You're not going to do whatever it is that you're doing for like the end of days until you die. Certainly not at the same level, number one. Number two, what you're doing, what you're high performing at might have to change and switch at some point in time. And that's okay. It didn't make you you. You were doing well at that thing because you're who you already are. And you have to know that about yourself. One, because that's going to help you to perform better, but also because then you don't feel like you've lost yourself if something has to change. If there's one thing that I definitely want for athletes and other high performers to remember is that when that time comes for this to no longer be the thing that you're high performing in, it doesn't change who you are. And you were doing well and you were great because you're you, not because of how well you were doing at that thing. Even if other people would have you think that your worth is tied to that, it's not.
Thank
Yeah.
you. That was definitely a great wrap up for this whole episode. So if you have not gone to her website, please do. She has a beautiful website, a lot of information on there that'll be helpful, even if you never end up seeing her as a provider. So go to the website, WCM Sports Psych. She's here changing the face of sports psychiatry, changing the way that we treat athletes and high performers. So thank you, Dr. Wilson, for coming on. I really appreciate you. We didn't even talk a lot about Raymond. See, I told you it was about
So
you.
thank you, because it's supposed to be my show.
It's your show. It's your show. Tell him he got to get his own show. But anyway, hey, thank you very much. Thank you for your time. And we'll continue to grow together.
Thank you so much. It was so nice talking with you and your audience. Thanks for having me.
Absolutely. And tell everybody outside of your website, where else can they follow you along with for more information?
You can follow me on Instagram, WCM Sports Psych. You can follow me on LinkedIn, my full name, Dr. Wilsa Charles Malveaux. And I'm on Facebook as well. If you look up WCM Sports Psych on there, you can find my business there, and also YouTube. And I have to plug, because I just dropped the newest episode yesterday, but the Mindscape Report with Dr. Wilsa is my podcast, and your host here is going to be on it at some point in time. I'm just putting that out there. But yeah, check me out there. You can follow my channel on YouTube and see the episodes as they roll out, plus the other shorts and information that I publish. So there you go.
Absolutely. Excellent. Well, thank you for the work you're doing and be blessed.
Thanks. You too.
Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.
Time out with the sports doctor. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust you don't want to miss. This is where life, sports, and medicine.